Hello, AGA's allies and caregivers. You are listening to our podcast, The Rare Advocates, a caregiver worthy and rare disease podcast brought to you by Aicardi-Goutieres Syndrome Advocacy Association, where we update you with the latest news and conversations around Aicardi-Goutieres and rare diseases. My name is Betty. I'm the producer and marketing director, but most importantly, I'm mom of two boys. The youngest one, Noah, who was recently diagnosed with Aicardi-Goutieres just last year. The stories and conversations you're about to hear are really close to my heart, and I hope that they help you as much as they're helping me, whether you're a caregiver or know someone who has Aicardi-Goutieres syndrome. Before we get started on today's episode, a special thanks to Beacons, so much more than a link in bio. A whole set of easy to use tools for building a business made for creators like you. And last but not least, do not forget to join the conversation. We are now on all social media platforms, so be sure to subscribe. In today's episode, we have Dr. Jonathan Santoro, who will be sharing his expertise in pediatric neurology and experiences treating patients with Aicardi-Goutieres syndrome. We'll be talking about the diagnosis and everything he knows about the treatment. And I'm going to go ahead and invite him over to our screen. Thank you so much for joining me today, Dr. Jonathan Santoro.
Thank you for having me. Honored to join, and hopefully we can have a nice discussion about a very interesting disease.
Yes. I heard about you through various people that also have kids with Aicardi-Goutieres syndrome. So I'm very excited to just learn about you and everything that you know about the treatment. So with that said, can you tell me a little bit about just your background and your specialty?
Of course. So I trained to be a pediatric neurologist. I've always had a love for children with a variety of different neurodevelopmental issues. And I did additional training as a fellow in neuroimmunology. So, how the immune system can be active or inactive in the brain. And I finished my fellowship, came back, I should say, to California and started a neuroimmunology program at the Children's Hospital Los Angeles. And now we have a large clinical and research program that focuses on everything from AGS all the way up to things like multiple sclerosis and autoimmune encephalitis. So we see a high variety of things, but it's never a dull moment over here.
Oh my goodness, I bet. Well, my youngest son, his name is Noah. He was diagnosed with Aicardi-Goutieres just last year. And although I met a few neurologists, I've never met someone like you before. So I'm very excited to talk to you. And for our audience, parents and caregivers, and those who know someone with Aicardi-Goutieres, to just hear your perspective about the syndrome. So with that said, could you tell me a little bit more about perhaps your first few encounters with patients with Aicardi-Goutieres? Like, what are the first symptoms that they start showcasing, and what was your first experience like?
Yeah, I think my first experience with the condition was actually when I was still in medical school. So I went to medical school in Louisiana. There is a very large population of Acadians there, and by default, they have a lot of unusual autosomal recessive genetic disorders. And so I saw one or two patients with AGS there. And what I learned from my mentors at the time was that there was nothing to do, that we knew it was genetic, and that was it. And that no matter what therapies we could throw at this condition, it was uniformly going to not be a very good prognosis. And that kind of kept with me. And I think that when I got into my fellowship training in neuroimmunology, and I kept looking at these genetic disorders that have immune components to them, I started to read, Adeline van der Veer's literature and a variety of other neurologists and neuroimmunologists in the space, and it just kept clicking to say, while we think of these diseases as untreatable, we're probably on the verge of being able to have at least a therapeutic intervention, if not a cure in the very near future. I think that's the most exciting thing about being in neurology right now, is that many of these diseases that were incurable, untreatable, are now getting their time in the sun to actually reverse and at least hold some of the symptoms that we've observed historically.
Back when you first encounter your first patient, it was like, it's genetic, there's nothing we can do about it. And so that just must be like devastating to the parents, to the caregivers. But what were the symptoms that the patient was, complain, depending on the age, or the parents were advocating for? What were the symptoms? So, and the reason I like to ask this question is because it's such a wide spectrum, and we feel very, very lonely. So I feel like the more we hear, similarities, and we hear that other parents are going through the same thing, even though we're lonely, we kind of do form a community and we feel less alone.
Absolutely. And I think that, you hit the nail on the head is that, every child with AGS I've ever seen has presented very differently and has had different paths to a diagnosis. Some have been very quick, others have been months, sometimes years to diagnosis as well. I think that the most common symptoms that we see are very early in life. It's that failure to thrive, difficulty feeding, difficulty gaining weight, jitteriness. And then really when we start to get involved as neurologists is when there's a concern for seizure activity, when the head size is noted to be small, that term is microcephaly, or we see that some of the other organ systems are abnormal, so that the liver is a little bit large or the platelet formation in the blood is not exactly the same. And then we start to put these pieces together and then do the definitive testing to reach the diagnosis. So we've had patients come straight through neurology, we've had patients come straight through genetics, we've had patients come through the hematology clinic. So everybody's a little bit different, and I think that that's what makes it so challenging up front is once you get the diagnosis, you look back in hindsight and you say, how could we not have picked these things up? But I think that there's not one playbook for each patient with AGS, which makes it complicated.
It's so scary, especially when us, the parents or the caregivers, don't know what's wrong, and we're still, trying to get answers, and we're just going to the pediatrician, and we're just trying to explain what's wrong, and especially if they're first-time parents and they have nothing to compare and against, and they not only explain it to the pediatrician, but explain it to the family members. It's so hard. So maybe that's another really good question that my audience has, the parents have. How do we explain this rare condition to friends and family?
Yeah, this is a great topic. So I think one of the ways that I've always advocated for really any patient with a rare or unusual disease is to create a one pager, almost to create the elevator pitch, if you will, to how do you explain this to somebody who's just not medical, who's never heard about anything. And I think that with something like AGS, there are ways that you can explain it to say that this is a genetic condition. It affects all of the organ systems in the body, including the brain, and that these are some of the symptoms that are associated with it. This gene causes this problem, and specifically in Aicardi-Goutieres, you wanted to be talking about the inflammation that is being caused in the brain, and how that there's no one specific treatment for it right now, but there are new developing therapies that are coming out, hopefully in the very near future.
Yes, yes. And it's such a hard time too. You're getting the diagnosis, for those who are getting diagnosed, from 2019, before 2019, and not having a treatment that we're going to talk about. And then after 2019, trying to acquire the treatment, but while also dealing with everything that's going on in the world, right? So we have right before the pandemic, during the pandemic, and after the pandemic, there's just so many obstacles. And from my understanding, with Aicardi-Goutieres kids, or even a young adults in some cases, it's really difficult to try to keep them healthy. And I know that's one of your areas of expertise. So maybe before we jump into the treatment, can you talk about how we can keep these kids healthy during these difficult times?
Yeah, well, and I think that this is one of those things to say you kind of have to be ready to go to war, right? So once you actually have the diagnosis, there will be 1,000 reasons to not start a treatment, to not go to the doctor's visits, and it can be for a variety of different reasons. with the pandemic, it was the fear of getting infected. And certainly that was a very legitimate fear and caused a lot of interruption in healthcare that people were receiving. On the other end, you have the initial impact of dealing with a really challenging diagnosis, right? And some people, including myself, if this were to happen to me, we don't want to deal with it. We get bad news and then we kind of shut down a little bit. And I think that that's another reason that we see a little bit of a delay in care. And then on top of it, even when you're ready to access care, access therapies, there's insurance issues, there's transportation issues, there's, 1,000 other things that can come up. So, when I look at it as, well, how do you get the best care? How do you stay the healthiest? It's really suiting up and preparing for any obstacle that can kind of enter your path, because it's never going to be easy for parents and caregivers of individuals with rare diseases, including AGS.
And you just started the next topic, which is okay, you finally get the diagnosis, you're going to the doctor, you are preparing for the next war, which is, okay, there is a treatment out there. So let's talk about what the treatment, besides, what you mentioned earlier, if there's seizures, then that's a separate, treatment that you have to take care of. But specifically for AGS, there's a treatment now. Can you talk about what the treatment is and how does it work?
Yeah, so the treatment that has been reported now in the New England Journal of Medicine as a case series, meaning a small number of patients, is a JAK inhibitor. And the JAK-STAT pathway is one that controls our inflammatory response in the body. And so by using this inhibitor, you kind of damp down that entire process. And the way that I kind of explain this is that you have a runaway train, and now you're able to get it back onto the tracks. The challenge with this, though, is it's not a randomized controlled trial, which is kind of the gold standard for getting medications approved. There's not an FDA indication for this therapy, and it is largely still experimental. But I think that when we look at diseases, whether it's an AGS or other rare neurologic disease, when there is no other treatment, this is the best that we can do right now. And ultimately, we may find that these types of treatments aren't the best for every single person with AGS, but until we have that additional data, this is the one that has, kind of come out and been kind of the light at the end of the tunnel for many patients and caregivers right now.
So far, with the patients that have taken it, what's the light at the end of the tunnel that you mentioned? What is it showcasing so far that's quote unquote promising and giving us some hope to parents?
I think that one of the best things that we've been able to see with these types of medications is that they slow down the deterioration. They don't stop it. They don't reverse the disease process, right? We're not there yet. But I think that in terms of being able to spread out the, good days and to spread out the, unnecessary visits to the hospital sometimes, I think that that's where these medications have been particularly helpful. I think that the other piece of this is it's allowed longer periods of time for communication for many individuals. And I think that that's a hugely important factor for kind of that parent-child interaction or caregiver-child interaction. And I think that as one of the other additional features that we really have enjoyed seeing with this new medication is that it reduces a lot of the irritability that can be associated with AGS. So our patients who are on treatment seem to be more comfortable, seem to be a little bit more calm, and that's hugely important for quality of life.
Yes. I mean, and as you're saying it, I'm trying not to get emotional, but my son has been on JAK inhibitors now for a couple of months, and he only cries when he's hungry. And it's so nice to hear coming from an AGS parent. And with that said, you also mentioned, it doesn't stop the delays. It doesn't, it's not a cure. It just slows it down, which still really sad to hear. It puts my feet back on the ground because, I wish there was a cure, and there isn't one. So with that said, if we were to stop the treatment, what does that mean? If we were to stop the treatment for whatever reason, that may be.
Yeah, it's a really good question. I think the short answer is we don't have great data to know what will happen. I think that our biggest concern is that that decline would speed back up again. And I think that for patients who are on these types of treatments as part of a trial, and then we get to the point where we have to get a commercial insurance or a state-based insurance to kind of pick up the treatments. That's been our primary concern, to say that we don't want this process to start back up, to go back to where we were before, because we know what that looks like already. What we don't know is the long-term use of these medications and how much extra time, extra quality time we're going to be able to get with our loved ones.
So, with that said, acquiring the medicine, it's very, very important. And I know you have experience prescribing it and then also experience talking to families who are constantly advocating for their kids, you know, from their side, right? Because they're also responsible of the insurance part. You're responsible of the prescribing it, So there's so many people and so many parties involved. So let's talk a little bit about what families go through acquiring the medication, and also what kind of effort doctors have to put in to make sure that the families do get the medication.
Yeah. So it's a roller coaster for both families and for the prescribing doctors too. Because if I'm prescribing a medication, it's because I think it's going to help. And when we get those first denials, I feel just as frustrated as everybody else. So I think it ends up coming down to two things. Is one is patient, family and caregiver advocacy. So calling the insurance company, letting them know exactly what's going on with this condition, the rareness of it, the uniqueness of it, and that there is high level published data on it right now. And that's the best we have. I think on the physician end, it takes a lot of advocacy. I'm not that old, but I'm getting more and more gray hair in my beard and my hair because of the amount of time I have to spend on the phone with insurance companies. But don't forget, insurance companies and state based care programs, the default answer is always going to be no. So you can't take the first rejection or even the second rejection to heart. You just have to keep fighting and keep advocating, because eventually you will reach somebody who will understand what this disease is. They'll read the data that you send them, and then we'll be able to get the medication approved. It's never easy, but we can get it.
Yes, and you just said something that I had not heard before, and that's maybe we should be expecting a no, just like go in with the mindset it's gonna get declined, and that would have helped me at least, saying, hey, it's gonna get declined, and then be like, okay, it was expecting. So I'm hoping that any parents that are about to submit it, they hear this, it's just like to help them prepare.
Yeah, negative Nancy when I'm talking about the medications, but it is good to just set the expectation that the first thing that you're going to hear about this medication is a denial. You'll get an email or you'll get a message in the post about it. And it can be frustrating, but it's just when you're mentally prepared that you're going to have to jump through the hoops to get these types of medications, I think it helps you kind of prepare for the marathon and not the sprint.
Yes, and from the doctor's perspective, as much as you can share, just in case, the patient is sharing this with their doctor, like, hey, listen to this podcast, how much effort in compared to other medications, or, just in general, do you think you have to put in, like, certain number of cases, definitely pull every research paper, or is there like any tips or advice so that you can help others out there?
Yeah, I mean, you're most of the physicians will know that, rare diseases like AGS, it's going to take about 5 to 10 times the amount of effort as it would for another medication. It's a
Oh,
lot.
wow.
In neuroimmunology, most of the things that we prescribe in pediatrics are off label. So we're used to it. My nurse understands, my coordinators understand. We know the game at this point. But I think that for a general neurologist or even for a geneticist, it's not something that you encounter very frequently. And you have to be prepared on the physician side to be ready to kind of go to war and fight for the things that you need or that your patients need. We've worked with doctors across the country. I am always happy to share my appeal templates, and any other resources we have. I mean, we've had one situation, not for AGS, but another very rare disease that has immune components, where I jumped on the peer-to-peer phone call with one of the other doctors because they didn't feel comfortable talking about it, and that was going to be the only opportunity. So I think that in this community for AGS, there's a lot of doctors out there, there's a lot of clinics out there with expertise, but the neurologist down the road may not have evaluated this in their career because it's a rare condition. But the community on the physician side is very supportive and always willing to help.
Wow. And you just said something that I never heard before, 5 to 10 times the amount of work. That's a lot. That's a lot of work, especially because, your AGA patients are not the only patients. So I'm sure it includes a lot of extra long hours. So thank you for that, for taking care of your patients this way. We really, really, really appreciate it. And I mean, you just mentioned something that I didn't know. And that's, for a lot of these pediatric, rare diseases that, are neurological, a lot of things are off label. So more common than we know. And that's just, it's good to hear these things because sometimes we need to normalize something that's so rare to just, not be so discouraged and be like, oh, you're prescribing me something that's off label. Oh, you're giving me something that's experimental. Oh, you're giving me something that usually gets a no. That shouldn't discourage families, because I think the JAK inhibitors are, from my personal experience, have made a huge difference.
Yeah. And I think it's even one of those things where we've had other doctors say, you know what, I'm just not comfortable prescribing these medicines because they're not frequently used either. So, again, it's like this, when you're kind of aware that there are going to be multiple obstacles, it may be the physician, it may be the insurance, it may be just accessing the care. I mean, I think it just sets you up to understand that you can't really predict upfront what the barrier will be, but there will be some. And I think that the more mentally prepared families and caregivers can be, the better off kind of mental health wise everybody's going to be. Because at the end of the day, everybody's working towards the same goal of trying to get these new medications to try.
Yes, thank you so much. And so let's talk a little bit about now that you have patients, you finally get the approval for the JAK inhibitors. A few months have passed. They've been on the JAK inhibitors for a while. What are the things that you've seen that you're like, yes, this was due to the JAK inhibitors and this was worth going through all that effort with? What are the things that you hear parents and that you see that are helping the patient?
Yeah, I think that one of the biggest ones is actually something that you brought up was that irritability goes down pretty quickly. And I think it just allows for so much better bonding and caring with the child that it really just takes this heavy weight off of a lot of families and caregivers when they say, when you ask what is the biggest improvement. I think that long term we see a lot of the feeding issues and a lot of the intolerance issues for seizure activity, for the developmental stagnation, be a little bit more drawn out. So there's a lot of good days compared to the bad ones. I think that when we're looking at kind of pre and post JAK inhibitors, which has always been really nice, but it's very interesting because we have patients who have started JAK inhibitors at multiple different time points. Some have been very young, some have been a little bit older, and I think there's not one patient that has one singular response to these medicines. They all help in different ways.
Yes, yes. Because when you say, different points, well, so one thing you mentioned for those who are new to AGS is there's a wide spectrum, what symptoms each patient has, because it can be look very, very different on each patient. And then the second thing is some of them may have it early, and that's early onset, and some of them may have it later in life, and that's late onset, correct?
Mm-hmm. Correct.
And so with that said, they may start, the JAK inhibitors at different points. Not only that, JAK inhibitors just started being prescribed not too long ago. If I'm correct, it said 2020?
Mm-hmm.
Okay. So there's patients that have had AGS for a lot longer without them being treated. But regardless, so far from the little we know, they've been very positive and they've been worth prescribing. Correct. And I'm just
Exactly.
summarizing, especially for those who, are new to the AGS world and they're trying to, keep up with our conversation and understand um, where everything falls into place, because it's just so different from kid to kid. What advice do you have for families who know maybe they were just diagnosed yesterday and they're about to start their journey? And I know you already said get ready for work, but if you had any last piece of advice for them, what else would you?
I think take credit for the small things. Those little moments on the good days really are important. And, again, we don't have a cure for this condition. And even the best therapy that we have right now only slows the process down. It doesn't stop the process. And I think that in the future, I'm very hopeful. And, it's an exciting time to be in neurology because I do think that there's going to be advances. But looking at the big picture, when you start to talk to families who are at different ends of the spectrum, from new diagnosis all the way to having a diagnosis for many years, those little moments that you have with your child and your loved one and your family all together, I mean, those are really important, and you have to kind of take them because there will be hard days and there will be frustrating days. And so keeping an inventory of those really good moments is a way to keep yourself going, to keep your mental health, moving forward, because your loved one, your child is going to need you to be at peak performance to kind of do the fighting, do the advocating, and keep on marching so we can get closer and closer to stopping this disease and condition.
That's a good reminder, even for myself. Okay, Dr. Santoro. So, one of the things that we want to start doing on the podcast is answer questions from our audience. And one of our caregiver asked if they should stop, pause, or discontinue JAK inhibitors for common illnesses such as a cold, maybe if they have a fever and they don't know what it is, and take kind of like a holiday break from the drug. That way they can see what their kid has and then jump back on it. So I would love your opinion and to learn more about what happens when we pause the medication for these like common illnesses.
So, I'll give a little disclaimer before I answer is that you should always discuss this with your doctor because the individual is always going to be different and no one virus or no one infection is always the same. But I think that, one of the prevailing thoughts is actually to stay on the treatment during those acute illnesses. And the rationale is that the JAK inhibitors are preventing overactivation of the immune system. And rather than being the specific virus that causes the problem in persons with AGS, we think it's just the overactive immune system that, again, is that kind of that train that goes off the tracks. And so the JAK inhibitors may actually suppress or dampen some of that excessive response that may be dangerous to the brain and other organs. So, I don't know if we have the data to strongly support it, but I think that the prevailing thought amongst most neuroimmunologists in the community at this point is to stay on it unless there are specific unique circumstances. So always talk about it with your doctor. But I think that, the thought of coming off the immune suppressant when you're sick does make a lot of sense at face value. But I think that the way that JAK inhibitors are preventing disease in persons with AGS is a little bit different and unique as well.
Yes, yes. So for our audience who asked that question, I love how you're answering. One, check with your doctor. So for us to make that call, we should not be making that call. That's the first. Two, speak to our doctor and make sure that, you tell them, I would not like to pause it, and just have that conversation where you're advocating for your child, but you're also listening to the doctor. And those conversations need to happen because this should be taken very seriously, right? So I think
Absolutely.
that's the most important thing, because we don't want to hurt. We want to help the AGS patient as much as we can. And I think, you know, this is just, another reason why we should be in constant communication with our neurologist and, keep good track of when our child gets sick so we can write everything down and we can provide everything we're observing to our neurologist so they can make the best call based on lab results and so forth.
100%. And you can provide really fantastic information to your doctor. I'm not saying that you have to be an engineer and document every single thing that ever happens, but I think that when you know how your child reacts to different viruses when they do get sick, or when they need to go to the hospital and when they don't, and what are the symptoms, what are the signs that you see, I think that's really, really helpful to communicate with your doctor and to also know as a caregiver and a parent, because it's a relationship, right? This isn't a one-way street where the doctor is saying this is exactly what has to go on. I mean, you can provide really fantastic data, really that is often objective to your doctor as well, so they can make the informed recommendation, depending on the situation, obviously.
Yes, yes. Thank you so much. And to our audience who is listening to this, if you're a caregiver and you're part of the AGSAA Facebook group and you have more questions that you would like us to talk about in our podcast or on our social media, please let us know. And Dr. Santoro, thank you so much for taking the time to speak to our community. And those are, allies that, are helping and supporting those who are caregivers to AGS patients. And the caregivers are also listening to our podcast. We're all very thankful that you took the time out of your busy day to day.
Oh, it's my pleasure, and just know that you have a physician community behind you, rooting and cheering on for your loved ones behind the scenes.